and welcome to the second presentation of the 6th season of our CF Discovery Series. I'm Siri Baith-Dunn, Programs and Outreach Manager for Cystic Fibrosis Research Incorporated, or CFRI, and I'm very, very pleased to welcome both our guests here in the room, as well as our online guests. Our fearless Executive Director, Sue Landgraf, is unable to be here tonight, but she does send her best to all of you, and she thanks Dr. Mark for being here tonight. Tonight, Dr. John Mark, Pediatric Pulmonologist at Lucile Packard Children's Hospital, Stanford, will discuss integrative medicine and cystic fibrosis. Dr. Mark is an expert in the field, and I know that I speak on behalf of our diverse community when I say we are all looking forward to hearing from you. Before getting started, I want to thank Genentech and Vertex for generously sponsoring the Discovery Series, and I thank Gilead Sciences and AbbVie for their additional support. As always, we urge you to work together with your healthcare team. Please note that no information presented tonight is intended for a patient's diagnosis or treatment. We will leave that to your specialists. Tonight's program is being produced by our CFRI Live team. You know them well, Scott Wakefield and David Suhu, as well as Mary Convento, who's tracking questions from our online participants. I encourage everyone to ask questions of Dr. Mark. This is a great opportunity to hear directly from the expert. Online viewers, please click in the chat box that's on your screen, and you can type in your questions, and they will be asked during our question and answer period. So let's get started. Now, here comes the part about you. Tonight's topic is of vital importance to the CF community as our understanding of integrative medicine and its complementary role with CF medical regimens grows. The term integrative medicine is very broad, and we're fortunate to have an expert here with us tonight to help viewers learn about what alternative additions to their medical routine are helpful and which may actually be harmful. It is my pleasure to welcome Dr. John Mark, pulmonologist at Lucile Packard Children's Hospital, Stanford, who has worked with CF patients for many, many years. As the first pediatrician in the United States, sponsored by the National Institutes of Health, to be trained in complementary and alternative medicine, Dr. Mark is truly a wealth of information for our community. Please help CFRI welcome Dr. John Mark.
Thank you. Thank you very much for allowing me to talk tonight, and I hope our online viewers are all tuned in as well, can hear okay. Before I go into this talk, some of you, if you were at the CF Education Day for Stanford last Saturday, you heard a similar talk, and actually some of the slides will be really the same. But what I wanted to do tonight, which I was so excited about being allowed to talk at CFRI, is actually to slow down a little bit, because I don't know if people know me, I talk pretty fast. Actually go into the slides in a little bit more detail and actually get some of the thought behind them, and not just give a lot of facts and figures and resources and things like that. I think one thing that would help before we even start the objectives is how I got into taking care of children and adults with cystic fibrosis, and when I did my training in Kansas City at Children's Mercy Hospital, there really wasn't a pediatric pulmonologist in the whole city of over 2 million people. And at that time, the CF, that was in the late 70s, and at that time, the life expectancy for cystic fibrosis was under 20 years of age, really, and we really became very close to our patients, and because they were all ours at the Children's Hospital. And the clinic was run by a pediatric infectious disease person and pediatric gastroenterologist. And so I thought when I finished, since I kind of really became interested in this group of patients and other children with underlying lung disorders, that I would go off and learn how to become a pulmonary doctor, a CF doctor, and come back to Mercy. However, I just never quite made it back to Kansas City, and came out to California instead and went to UC Davis in the mid-'80s. And during that time, though, I continued to follow all these children that had with cystic fibrosis, even the ones that are back in New York. And if people were there on Saturday, you might remember that I said that I recently gave a talk last spring in the CF Education Day in Rochester, New York, and it was co-sponsored by one of my former patients who's now 37 years of age and just got married. So you can see things have really changed even since the 80s with all types of things. And one of the things that she does that's really fascinating is that she uses all types of alternative and complementary medicines to her conventional care. And so I have patients that still, when I was at the University of Arizona, when I was at Rochester, when I was at UC Davis, they still write me and ask me these questions. So what happened is I was at UC Davis for a couple of years and decided that academic medicine really wasn't my cup of tea, and I met a woman who wanted to be an artist in Santa Cruz, so I said sure. So I moved to Santa Cruz. And during that time period, I kind of set up outreach clinics for UCSF and Stanford and other people, and saw the children down there, including CF patients. And what was fascinating about that is that they all would come to see me only when their non-conventional therapies didn't work. So their acupuncture wasn't working, the homeopathic remedies weren't working, their masseuse wasn't doing the job, and so I guess they would come finally see me reluctantly. And instead of kind of shunning them, I actually wanted to learn from them. So they really taught me a lot over those 15 years or so that I was in the Central Coast of California. And then I had this opportunity to go down to the University of Arizona and have this NIH-sponsored 2-year fellowship with Andrew Weil and the other people down there, and we studied things like echinacea and chamomile and acupuncture in children with all types of various illnesses. And of course, I was interested in lung disorders like asthma and cystic fibrosis, so that's what I tended to study. And so during that time, I thought, well, I'll come back to Santa Cruz and just become this alternative guru type guy. But then, by golly, I got back into academic medicine, and before I knew it, I had a job at the University of Arizona. I was seeing patients in the neonatal and pediatric intensive care unit again. I was doing procedures. I was running the fellowship program. And then I decided I needed to come back to Stanford because my wife actually never left Santa Cruz. So after 6 years of being in Arizona, I came back to Stanford. I've been here about 10 years now. And so we actually have been building this up over the last 10 years, and I kind of call it the infiltrative approach to academic medicine. Because, academians, they kind of like to know just what they know, and they don't really like to read too much out of the box. And so I can talk freely because I don't think there's probably a lot of my colleagues are listening to this online, and there's nobody in the audience. And so really what this talk is for the patients and the people and the parents and colleagues and friends who actually have children or young adults or even older adults who have cystic fibrosis. And this is really about how do you really make this into your approach for your care. And there's lots of things we could talk about, all types of alternative therapies like, acupuncture and dietary supplements, but that's not really what the talk's about because each one of those areas in itself could be a whole day's lecture. It could be a whole workshop. So you're not going to just walk out of here and say, okay, now I know everything about Chinese medicine. Now I know everything about homeopathy. But you at least have an idea about how to discuss these things, how to maybe do some research in these areas, and that maybe if you're interested in them, about how then to push forward and then use them in conjunction with your conventional therapies. So really, the objective is to better understand this holistic approach. I wish I could say that every one of my colleagues at all these institutions I've been at over the last 30 years had the same approach. Some do it better than others. Other people kind of just like when you start to mention the dietary supplements you're interested in or some of these therapies you're interested in, you kind of see them like fade away and kind of look at the wall, and all of a sudden they're like, I think I'll write my note now. And I said, you really need to bring them back to the center and really discuss it with you because that's really important. We really want to know how this team can work with patients and families and really improve care and outcomes. We want to discuss strategies. So what do you do if you're already on all these different oral medications and you want to add different supplements? When do you add them? How do you add them? Which ones are the same? Which ones are complementary? Which ones actually may work against each other? Those are really important questions to understand. And then you want to become comfortable in discussing them. I had a patient that one of my colleagues followed who came down from Northern California, Eureka, 4-year-old. I think he was on 35, maybe 40 different supplements. And we'll talk about that in a minute, but that was fine. But I really needed to go down and really needed to discuss every single one of them, just like you would discuss every single type of antibiotic and every type of enzyme and every type of H2 blocker and all the other medications you might take for your underlying disorder. So the reason I gave this talk last Saturday, and I followed Preston Campbell from the CF Foundation, and he gave this very dry kind of talk about all the different medications and how they affect everything in the CFTR pathway, which is great because I think it's really where a lot of the progress is being made. It's going to be a really exciting field, and there's some areas of CF that now seem like you can almost stop or even reverse. But really, it's a multi-system disease with a broad spectrum. So why does somebody with a same mutation be right next to somebody else with the same mutation, and they seem to be so much sicker than the other person? So it can't just be at the enzyme level. It can't just be at the protein level. There has to be something else that kind of fits in too. As you know, it's a genetic autosomal recessive. It's progressive, especially pulmonary, and it has to do with this abnormal CF gene, the so-called CFTR. And there's these 5 different areas, and many of you know the different things about that. But what I want to point out is that one of the most important part is that there on the right is the environment. So it has to do a lot with the environment. So it's not that you just take your medications and you're really adherent, which if everybody was, that probably would help a lot. But needless to say that some people don't do all those things. But even if you did, some people would still do much better than others. Why is that? And it may have to do with what the diet was prenatally. It may have to do with where you were born. It may have to do with the stress in the family. It may have to do when you got your first viral infection. What kind of viral infection was that? may have to do with what type of nutrition, what type of proteins, what type of fats that you eat. I mean, all those things can modify the response to this protein that may not be working so well. So really what I focus on is the environmental part of it that really can influence the outcome. I always like to put in one of these case study, and this is, I picked an adult, but this could be a 5-year-old, a 15-year-old, or a 25-year-old, because you have patients like this that are at all ages, really. And she's a Delta F508 homozygous. She has a little bit of diabetes. She has a little bit of liver involvement, but she's done pretty well. She's graduated from college. She's married. She requires 1 or 2 hospitalizations a year for so-called tune-ups. And she comes in with not really any pulmonary symptoms, but she doesn't feel that well, and she really wants to do something different. She doesn't want to just add different medications. And I always make fun of Terry Robinson in my group. If he thinks of something, he'll start it. And it's like, okay, well, sometimes we need to kind of think about what people really will do and what they'll really take and what really works the best, and things maybe aren't doing so well. Maybe we can get rid of that one. So you want to do a balance. And so she wants to do something else besides medications. She also has a history of good adherence. I always put that in bold and dark blue, because if you can't really follow what your conventional therapies are, it's very hard to follow what I'm going to suggest that you do, which is whole lifestyle change. Has to do with good sleep and exercise and eating right, and that's not easy to do. It's much easier to kind of burn the candle at both ends and not do things very well and kind of have a life that's a little bit more chaotic. But that's not really great if you have a chronic illness. So she's on Combivent, she's on Pulmozyme, she's on hypertonic saline a couple of times a day. She uses a vest with Acapella when she doesn't have when she went for airway clearance. She has Advair, Rhinocort. She's on sinus rinses for her sinuses. She's on once a day insulin, Lantus. She's on some Pancreacar. Sorry, I should make this Creon for the talk tonight. She's on Actigol, Afex, multivitamins, ADEC, vitamin K, azithromycin, and even Toby in the Podhaler. And this is an older version. You're right. So she's supposedly on the Podhaler, not the Nebs, twice a day. And she returns every 3 months, and she seems like that's a lot of medicines, right? I mean, that's a lot of things to do every single day. You can imagine just trying to figure out something else to do would be hard, but she's willing to try. So she says, well, what can she use? And she's really uncertain about the case, and she's worried about all these inhaled steroids. I mean, she's taken Advair that's got a steroid in it. She's taken Nasacort that's got a steroid in it. She has all these different things. She's on the insulin. And what's a more natural approach to the CF therapy? So when she asked her which one, they asked for help, but she goes, I don't know. So she said, you go online, you look up, you get Dr. Weil, my mentor down there in the bottom, and he has a little piece on cystic fibrosis. You can go to this green medicine, but actually if you put in cystic fibrosis and CAM, or alternative medicine, complementary alternative medicine, you get over 1 million hits in less than a second. So you can imagine trying to sort that out online would be monumental. So remember, cystic fibrosis can look at like anybody. I mean, you have all these kids, all the 3 kids on the left all have CF. One's a mountain climber. One's just getting ready to go off for her lung transplant there in the bottom in Arizona. One's a little guy that has a lot of problems. So just like you do with any type of therapies, if you have cystic fibrosis, not everybody gets the same thing because everyone's a little bit different. So some people might respond better to certain types of medications where other people don't. So I think you really have to talk with your provider and your team each time about what would be best for them. So the last few slides actually has to do more, not so much with alternative therapies or complementary medicine, but really has to do with this like a holistic approach. How do you really have this type of approach when you take your child or yourself in to see somebody with your physician, your healthcare providers? So really the current system of conventional medicine can be enormously frustrating. I mean, really, every time you go into the physician, they want you to do this or do that or stop this or stop that, and it seems like you never can get ahead of it. Sometimes you can, but oftentimes you can't. In many areas, it's just hard to get the answers as to how you're going to do and how long you're going to do well or not do well, whatever. And so you visit a doctor may result in drug prescriptions, which one might feel that comfortable with. The medications may keep the symptoms in check, but really, how do you really promote health? And that's really what we want to do, right? We don't want to just keep everything low down. I mean, that's one thing you have to do, but you really would like to get things better in certain areas. So this holistic approach doesn't really reject conventional medicine, but it's a form of healing or consideration that really takes care of the whole body. So it could be just by doing relaxation or mind-body or mindfulness, something like that actually may be as important as starting Toby or Cipro or going up to your treatments 4 times a day. I mean, you have to kind of think about what works and what really are the stressors, what's going on in the family. And that may be the better approach to take than just add more medications. We know that people use this. This is a study that came out a few years ago. And it was 97 children and adults with CF, of which 81% were parents. And about 75% of the parents used some type of complementary alternative medicine. The majority use biologically based supplements, which is like dietary supplements, herbal remedies, the stuff you go to the health food store, GNC. And I think that's one, it's always been the most common use for all chronic illnesses, and even for people who don't have disorders across the United States. And that's just because, in a way, it's the easiest thing to do, right? You just go to the health food store. You don't have to change your diet. You don't have to get a good night's sleep. You just go get another pill, and it says lung health. Why not take it, right? And so you can take that thing that has like 2 things in it. Why not take a thing that has 18 things in it? So it seems like that would make more sense. So people just traditionally, it's more of a Western approach. It's much easier than thinking about how your energy flows and your chi and how to make sure your chakras are open. I mean, it's a lot easier just to go take a pill than it is to kind of think about all those things. And maybe it is, and there are supplements that actually have a lot of benefit. But I think, again, that's why they're probably the most common. There are also a lot of problems with them, which I'll talk about in a little bit later. But you can see it's also followed by mind-body medicine and also manipulative therapies like chiropractic and osteopathic manipulation and massage. So people really do feel a health benefit when people actually have these type of therapies. A questionnaire study showed that it was useful. About over 75% said that it was useful, but only half the parents and the patients actually told their health providers that they were doing it. So again, that could be a problem because maybe some of these different therapies, especially the biologically based ones, the dietary supplements, actually may have some side effects. So I think that the study showed increased use of these complementary alternative medicines in patients with CF and the desire to have a better control and self-management. So I look at it as when patients come into me, and this woman came into me with her 4-year-old on almost 50 different types of therapies, it's like she really wants to make him better. She really wants to improve his life. I don't look at her like she's really nuts. She's going to drive me crazy trying to figure out all these. It's like, well, let's work together and let's tell you what makes her better, because that's the kind of patient I want. That's the kind, I don't want the person who just comes in and says, yeah, then walks out and doesn't do anything. That's the patient that's the hardest one, I think, to deal with. So when you have this underlying foundation for executive healing, it's really this compassion for a patient. And you have to really consider all the patient's nature, the family nature. It may depend on what, they may be from different parts of the country, they may be different parts of the world. They all have different cultural aspects. When I was at the University of Arizona, we took care of a lot of Native Americans from the Apache Reservation. And there, there's no kind of concept in their culture about preventive care. I mean, when you don't have the symptom, you don't take the medication. And we were trying to tell them that doesn't work very well with bad asthma. You're supposed to take these controller medications because they're supposed to control you, right? And they'd look at me like you had 2 ears or 2 heads. They're like, no, we don't do that. He's not sick. He doesn't need it. And then they also give the responsibility for taking the medications when the kids turn about 7 or 8. That's their responsibility. There's your puffer. They need it. They go take it. So again, it's really important to know that in the culture, because then it makes a little bit more time, a little bit more effort, maybe a little bit more type of discussions to get to people to realize about how you can sometimes use more medications early to try and get people off medications in the long run. So again, this whole complementary alternative medicine really covers a broad range of healing philosophies and approaches. Use this alone or in combination with other one is really this integrative approach. So many of CAM practitioners are holistic, and they consider all aspects, but not all of them are. I mean, I'm sure that some of you maybe have seen a homeopathic physician or a Chinese medicine person who just wants you to stop everything conventional. It's like, no, if you come see me, you have to stop all those things. Well, that's not any better than seeing the conventional physician who says, you can't take any of these dietary supplements, you can't do any holistic type of things, you can't do any homeopathy because that's all nonsense, it won't work. So you really have to have somebody who's really has that open mind, has that care that's transparent, who's really willing to talk to all your providers. So CAM practitioners who believe that disease is caused by deficiencies or spinal misalignments are really no more holistic than somebody who thinks everything is caused by microbes and germs. So this whole approach really is to establish this healing partnership with their patients, emphasize prevention and self-care. And this involves the whole team. It's not just your physician. It's your nurses, your RTs, your social workers, dietitians, PT, and even other CAM providers. They consider the patient's thoughts, feelings, and beliefs in prescribing treatments. And so they may incorporate one or several therapies. Teaching relaxation, where I'm trying to get Shruti, many of you know her, in our CF clinic to learn some mind-body techniques to teach mindfulness and relaxation to some of our kids, and especially our older kids and teenagers, because I think that really would help, because we know that stress can cause a lot of increased airway inflammation. Work with partnership with alternative practitioners. I mean, we're not all going to learn acupuncture. It's not easy to learn. You have to be, just like you go to medical school, you have to go to Chinese medicine practitioner school, and we have a few in the area that are very good, like 5 branches, both in San Jose and Santa Cruz. And they really have good practitioners that really can help us. And although the healthcare team can facilitate healing, really the ability to heal really comes within. So you really need to get the patient and the parent and even that reluctant teenager to get involved, and which is not always easy to do. But you can do it if you really take the time and really the effort, and you show them that you have the interest. So several factors are important to consider and determine your entire health. I mean, many chronic illnesses can be alleviated or improved just by certain changes in these areas, and people often never even talk about these areas. I mean, nutritional, environmental, structural problems can be seen in nature, and these can really affect your mental and emotional health. And these can possibly affect the body too. So, if you can really decrease stress per se, you can actually make a lot of things better, even actually have different therapies that even improve. So it's more than just what the medicines to take or the treatments to do. It really has to do this holistic approach. And then patients with chronic illness often reconcile the potential benefits or remedies derived from these different worldviews, right? And they really have this kind of ideas like, most of the people in the world have these different issues, and they have a different kind of ways to approach it. And it could be more spiritual. It could be different types of remedies that they've taken traditionally through their culture. And you have to kind of think of those, and you have to kind of adopt those. So that's why people want to have those involved with their care. And its use or itself doesn't really indicate a rational decision. It's not like, if somebody wants to use, essential oils per se, that's fine. I mean, that's something that you should embrace and say, like, they're really trying to help with their self-management. They're really trying to improve. They're really trying to decrease maybe side effects and different types of things that may be more powerful. And so it should be understood as part of self-care. And it's really consistent with taking responsibility for one's health to the extent that the possible context of a chronic disease. So if one sets CAM in opposition to conventional medicine, if you make them so one or the other and they're kind of at odds with each other, then I think that really can really decrease the whole kind of relationship you have with the family or even the patient themselves. So I'm just trying to tell everybody that when you see that, when you feel that, I think you should call it out with your practitioner. I think it's really important for the team that you tell them that you want to be working with them. You'll be willing to tell them everything. And if you can, you should bring everything in with you every time. And you can have a list, and you can write it down, and you can provide them. That's their responsibility, just like it would be if you're giving them different antibiotics or if you're on different types of therapies. You really should be able to look at those and then really help everybody do that. And it's not that everybody in your team is going to be knowledgeable in these areas, but there's going to be one or two people that, like myself and my team, that would be willing to do that for you. And I think if there's not, then you have to call that out and say, well, you need to get somebody in your team that's going to be it. Sometimes it's a pharmacist, sometimes it's a dietitian. I mean, Julie does a lot for our team, Julie Mattel, and Mary Helmers and other people, and Kristen too. They all help us try to sort a lot of these different therapies out. So it's just not one person. And if you have everybody kind of have an approach, then everybody learns from each other, and really you have a much better approach and much better outcomes. So this is one of the slides that didn't come through because we don't, for some reason, our animation didn't come through tonight. So these are the major classes. I told Siri that we're going to make people in the audience tell me what they are if they came to the talk last. So this is by the National Institutes of Health, the NCAM, National Center of Complementary Medicine, which actually they just changed their name. Now they're the National Center of Complementary and Integrative Health. They actually got rid of the word alternative because with the word alternative, you think like you use that instead of. And really what we want to do, we're not going to use stuff instead of, we want to use in conjunction with or complementary to. So that's now it's complementary and integrative. So what's the first major class of CAM? What's that? So acupuncture is part of what? It's part of Chinese medicine usually, traditional Chinese medicine. So traditional Chinese medicine, is that like Western medicine or not Western medicine? So it's not like Western medicine, right? It's like completely different. It has to do with energy and flows and meridians and pressure points. In Chinese medicine, it's not just acupuncture, right? It has to do with herbal remedies. Have anybody taken any Chinese herbal remedies before? Usually they give it to you in a bag. Usually there's like anywhere between 5 or 10. You go home and you boil them up. You decoct them into like a really thick stuff, and then you try to drink it. It smells awful, tastes awful. Sometimes gives you belly aches or even diarrhea. But I'll tell you, of all the herbal remedies, that's the one that really probably holds the most promise is the Chinese remedies. I mean, there's now the allergy immunologists are studying almost all types of chronic illnesses, and there's a lot of immunomodulating factors in these Chinese herbs, and they've been shown to be just as powerful as some steroids even, without even having the steroid side effects. So I think it's hard to get like a 5-year-old or even a 10-year-old to take these, but I think this is where a lot of studies are being done right now. So Chinese medicine. Another one would be Ayurvedic medicine, which is like the Indian version of Chinese medicine. Homeopathy, again, that's another one. It's a little bit. So these are all what we call the class of alternative healthcare systems. These aren't the ones that you go to medical school and learn about. I didn't ever go to medical school and learn about homeopathy or Chinese medicine, Ayurvedic medicine. So that's one class. Okay, so we only have 4 more to go. Does anybody think of the other one? I just trashed it a little bit a minute. Supplements. Okay, so biologicals. So but I don't hate them. It's just that they're really hard to sort out, and there's so many of them, and they have so much overlap. And so, so biological. So that's the one that's actually the most common one, right? So there's 2. Mind body, my favorite. because there's no side effects. It's just your mind. It's your mind, it's your body. You can try to help prevent, you can image things, you can relax, you can do stressfulness, you can do mindfulness. All these things kind of work together. So the mind body. So that's 3. Manipulative therapy, very good, Kristen. So we have, that'd be chiropractic, osteopathic manipulation, and massage therapy. And has anybody ever been to ever have osteopathic manipulation? That's like craniosacral, strain, counter strain. And it used to be, osteopaths have been doing this for over 100 years. In the 60s, 70s, 80s, even in the osteopathic schools, they kind of quit teaching it because they all wanted to be conventional doctors and be like MDs. So the DOs are like MDs. So now if you ask a DO, a doctor of osteopathy, he or she may not even know any. But it's made this resurgence because actually there's like 5 or 6 main kinds. There's over 100 different kinds. It's not just like the chiropractors who do the high velocities, low amplitude, the so-called manipulations. But they do all these other ones that are much more gentle. So osteopathic manipulation in Santa Cruz, I think there's at least a half dozen people who just do manipulations. They don't do any conventional medications anymore. They just do manipulations of all types. And there are actually some that are very good. And so probably because Andrew Wild down in Arizona really liked osteopaths, we really learned a lot about osteopathy. And there's different ways to approach different things like chronic pain, how to make your lungs expand better, how to get lymph to flow out, how to move secretions, all these type of things, much different than just chiropractic. And has anybody been to a chiropractor lately? If you go to a chiropractor lately, how much time do they spend just doing manipulation?
Well, it depends. My chiropractor uses many different techniques.
There's almost
30 minutes.
There's almost no chiropractor that just does the old tile, come in, crack your back, go home because you have lower back pain. I mean, they have all types of things because they understand they want to be integrative practitioners too. So some of them do pressure points, some do craniosacral, some do PTOT, some still do manipulation. They do all types of things. And so I think all these things are mixed in together. Okay, so there's just one more. This is the one that nobody ever gets. No. That's kind of more mind body. I don't know what it is. That kind of fits in there. It's energy medicine. So that's Reiki, healing touch, all these Jorei, all these different ones that have to do with auras. And it kind of goes into alternative. I mean, those kind of related. But you remember that people have been interested in magnets, and you have EEGs in your brain, you have EOGs in your eye, you have EMGs in your muscles, you have EKGs in your heart. I mean, your body is just one electric circuit. So if you think about it, how do you make all that stuff go together? And so these people, have you ever been to an energy healer? I mean, I saw one birdie who had a terrible migraine, and we were sitting at lunch, and this person came over, and while we were talking, she did this energy thing over her, and right in front of me, her nausea went away, her sunglasses came off, she started eating. I mean, it was amazing. She had migraines for 20 years, and she was an OB practitioner. And so, I mean, energy medicine is pretty wild. I mean, people use it in some hospitals even. Healing touch is has nursing origins, and it's been around since the 70s. And people do it pre-op, they do it post-op, they do it sometimes in the operating room. Sometimes you can use less anesthesia, use less pain medications, you can have less blood loss. I'm not saying I understand any of it, but energy medicine is pretty powerful. So Mesner, like in Mesmerize, he was interested in this also in the 1700s, and they tried to court-martial him in France, and even Ben Franklin went over for the big court dial. And he used to think that he could feel the energy going up trees, and he put people in bathtubs surrounded by magnets and really tried to draw energy in and out. So energy stuff's been around a long time, and you see it all the time. People have magnets in their shoes, magnets in their beds, they wear copper bracelets. All these things have to do with energy. So again, it's a very hard thing to study, but it's been out there. So you guys did good. So really, it's time to integrate. So it's time to build the team. So how do you do that? So you start with now you guys are all prepped. You know what you want to do. You talk to your neighbor, you talk to your cousin, you talk to your mother, you talk to your auntie, and they have some ideas about maybe what's a good thing to do. You've read some stuff online that seems like it has some reasonable implications for your child or for yourself. So now you want to build a team. So you start with knowledge of what you have and what the practitioner has. So if you have a 4-year-old and you're really interested in Chinese medicine and acupuncture, and the 4-year-old hates needles and blood draws, that may not be the best one to start with. So you want to start with things that actually that people are really going to use and have good adherence to. You want to discuss the ideas of any therapies. And just like there is with conventional therapies, you need to be followed up. And so one of the things that always kind of drives me crazy is that people will say, oh yeah, you can go ahead and start that dietary supplement. But did they ever ask you about that again? Did they ever ask about that manipulative therapy again? Did they ever ask you about that acupuncture again? Did they ask you about the Toby? They ask you about the vest? They ask you about your PFTs? They should ask you about all these things. And so it's really important to have that in your plan, in your CF plan. And all those things should be followed up. Because if they're not doing any better, and if you're actually maybe getting a little bit worse or not improving, maybe that's time to reassess those as well, not just your conventional therapies. So I think you want to develop a plan that can easily change. So where do you start? Like I said, 50 to 70% of patients with cystic fibrosis use some type of alternative medicine, complementary alternative medicine, and herbal remedies, dietary supplements. For patients who have mild to moderate disease, I usually do a stepwise approach. And I like to include my favorites, which is lifestyle, nutrition, maybe some supplements, some mind-body therapies, manipulative therapies, and maybe if they're interested in alternative therapies. So I think all those things I kind of bring up, kind of see what can weigh out the best, and then maybe just start with one or two. I mean, I think everyone really should have a good lifestyle. Everyone should have good nutrition. So those are almost like gimmies to me. But you'd be surprised if people don't. I mean, so CF is best treated in an attempt to delay or decrease progression. It's especially hard because there's so many regular treatments. You saw what this young lady was on. She was on all these different therapies 2, 3, 4 times a day. How's she going to do any type of lifestyle stuff? But you can do it, and we're even doing part of a study right now where we're actually trying to see whether exercise can actually be substituted for one of your airway clearance treatments today. Actually study it, not just say it's okay, but actually study it. So you want avoidance of allergens, tobacco smoke, irritants. So you have all these kids that are now going into high school and college, and they're getting to be older and young adults. That's a good time to get exposed to all kinds of bad things for your airway. So it's really important that you really make that clear that it's not a good time to try to slack off on some of these things. And just an avoidance. They don't have to do more treatments, but just trying to know what to avoid is important. Sleep and good hygiene, I can't say how much important that is. If you read it now all the time, right? If you have sleep disorder breathing, it gives you more trouble with blood pressure. It gives you a chance for stroke. It makes you not have cognitive levels not as good. Makes your airway clearance doesn't work as well. I mean, sleep and good sleep hygiene, going to get that 6, 7, 8 hours of sleep every night is very important. And that's really hard for kids, especially when they're teenage years and they get those bad habits about staying up late and getting up early. Exercise is one of my favorites. Hey, a lot of you know that I do a lot of running. I think that it's really important. Exercise can really improve your airway clearance. It can improve your lung function. It can improve your self-esteem. You can actually get off some of your medications, even some of your anti-inflammatories, and that's been shown in COPD and asthma. So it's good. Used to be considered dangerous. Now it's a valuable tool. It's actually a natural form of chest physiotherapy. You can use exercise substitute for pounding. I do it all the time. It's not been studied so much, but Duke had a great program for many, many years that was actually run by occupational therapists, and they would actually do exercise testing just like we would do spirometry to see how bad you were when you came in. They always should get back to your baseline before you went home. This is what they do in Europe all the time, in Germany and Switzerland and other places. They actually do exercise testing along with spirometry because they really want to get you back to your baseline. But again, it's really good for stimulating cough, helping remove secretions and better airway clearance. And like I said, ongoing study that we're doing right now through Pittsburgh and Stanford and other places trying to see if it can replace a treatment per day. It needs to come with some direction, too. You can't just all of a sudden decide you're going to run an ultramarathon. I mean, you need to, sometimes it's just baby steps, sometimes it just has to do, and many of you guys know Julie or heard of Julie Desch. She has a lot of online things. You can actually, I have her a website at the end of my talk. You can actually notify her, and she'll actually do one-on-one types of YouTube videos because it's really hard to get everybody in the same room to doing the same type of exercise, right, because of infection control issues. But she can really work with you, both children and adults. The regimen needs to take into account the patient's interests and limitations, so you need a kind of a prescription for exercise. It should be organized, allow slow increases, and it should have some monitoring. You don't want to all of a sudden lose a lot of weight if you all of a sudden become like an avid dancer. We want to keep your weight up. You want to keep your nutrition up. You want to keep your hydration up. So all these things had to kind of be taken into account. In areas such as nutrition, fluid status, and lung function should be watched closely. Which brings me into nutrition. Again, I think this is one of probably my favorite. I'm actually getting ready to go down to Phoenix in April to talk at the 12th annual nutrition conference that Dr. Weil puts on. And it's such a wonderful thing because we now know that nutrition has so much to do with any type of chronic illness and health in general. And so now we know it's not just fats, it's good fats. It's not just some carbohydrates. Now sugars are the worst thing ever now. And for all those years we said high sugar, high calories, whatever, just take it. And now we have all these repercussions from it. So I think it's really important to kind of think about this now. In chronic lung disease, it's been shown to have beneficial if you eat more fruits, vegetables, and other antioxidant-rich foods. Foods that are high in calorie, high protein, should also increase your consumption of fruits and vegetables. And also foods that are rich in omega-3 fatty acids, and those could be either vegetables like flax and your green leafy vegetables like broccoli and kale and things like that, but also fish and fish oils. And you want to kind of decrease your omega-6s. You need to have omega-6s, but not the high degree that so many people have been eating for all these years. When we were kids, and there's a few people in the room that are my age, But there's mazola oil. I used to laugh because my dad had a thing of mazola oil in his cabinet, I think, for 30 years. It never went rancid. I mean, that stuff was like so stable. The shelf life was forever. And that's because it's really stable, because those vegetable oils are that way. Or they go into your airways and go into your blood vessels. They go into all kinds of things, and they cause all kinds of havoc. Again, there's nothing wrong with having some omega-6 fatty acids, but it's been such a big balance when everybody put all these type of fats into all your types of foods, because they have long shelf lives, and it actually decreased costs. I just put this in there just to show that with cystic fibrosis, you do have all these different pathways, and it's actually been studied showing that this omega-6 and omega-3 fatty acids actually makes a difference. And if you have too many omega-6 fatty acids, it causes a more inflammatory pathway. Just like what Dr. Conrad uses their N-acetylcysteine, the so-called NAC, to try to decrease that antioxidant overdrive. Again, with CAF, it's almost like you have too much inflammation. It's like you're trying to pull it back sometimes. You're trying to stop it. And so sometimes that's what these type of nutritional supplements and stuff will try to help. So I think it's really important to try and do things like omega-3 fatty acids and other types of antioxidants. My favorite, again, is mind-body therapies. And again, these are your cognitive therapies. I mean, it's really not considered to be complementary and alternative anymore. I mean, mind-body therapies have been around since the 50s and 60s. They've been shown to work for inflammatory bowel disease. They've been shown to work for migraines. They've been shown to work even for things like diabetes. You can actually regulate your sugars better by knowing how to relax and have your decreased stress. And so all these things have been very important. But somehow they still think they're not quite right because it's like, I don't know, too easy maybe. Not expensive enough, I'm not sure. Because relaxation, breathing exercises, biofeedback, hypnosis, all these things can be very powerful. The theory is based on decreasing this inflammatory process that's brought on by stress. So when you do stress, and they did a study in kids and young adults with asthma, they did college kids that had asthma, they were on medications, and right around midterms and finals, they brought them in, they induced sputums to see if they had markers of inflammation. Their lung function was normal, they had no symptoms, they're taking their medications, and right around the time of their testing, they had all these increased markers of inflammation in their airways. So stress, we know, has done it. We also know now there's been some long-term studies, especially in the Boston area, that women who are stressed during pregnancy, their babies tend to have more respiratory problems in the first 5 years of life. Again, it has to do with this whole pathway about how you respond. Your immune response has to do with stress. And people ask me all the time, why there's so much asthma? Why there's so much lung disease in kids? You look at it, you say, look what we did in nutrition, look what we did to our air, and look what we did with our stress levels. I mean, it's amazing that any of us are okay. And I think that these are really something that are really you can really approach. So in addition to anxiety, stress is shown to influence the immune response. If you get stressed out, what happens? You get sick all the time, right? And if you're stressed out, when you do get sick, you don't get over the viral-like illness as fast as everybody else. If you got a good night's sleep, you eat well, you do things right, you exercise, it's like you get a cold maybe a little bit and it's gone like in 3 or 4 or 5 days instead of 2 or 3 weeks. And so that same happens for children and adults with chronic illness as well, whether it be diabetes, cystic fibrosis, or any type of ongoing problems. Excuse me. Self-hypnosis, breathing exercises, including yoga, one of my favorites, because it also has to do with breathing exercises to really make sure you expand all your airways. Relaxation with or without guided imagery. I mean, some people can just go right to a spot. I mean, you don't always have to sit down. Anybody done relaxation type of exercises? You sit down, you make the lights dim, you close your eyes, put your hands down, take some deep breaths, breathe through your nose, out through your mouth, and then you do it to like an 8-year-old. An 8-year-old goes, okay, I want you to relax, okay. I mean, they're there like that, right? I mean, they are so fast. We have to we have to clear all the clutter in our minds. We have to think about, okay, I have to really not think about, getting home and do all these things I need to do. They can just like, okay, they're like, kids daydream all the time, and we beat it out of them by the time they're like in junior high or high school, right? Quit daydreaming, pay attention. But actually that's perfect because they can go right to a spot and they can actually get there and feel better right away. And so children and young adults are really actually the perfect people to do these type of therapies. And so I think that really relaxation, especially with some imagery, is very important. And so you have a spot that you always makes you relax. If you start to get stressed, you go right to that spot. And you can have what they call an anchor, or something that just sets you off. You can always just think of that anchor. Sometimes it could be something you carry in your pocket. It could be a thought you had. It could be some music. It could be an app on your phone. Boom, you're there. And you can really get into that space and you go into a trance. Some people say, what do you think about when I do these 50K, 50-mile, 100-mile runs? I don't know. I go into a trance. I'm just in my space. I'm just going along, And I think that's what you can do for children and young adults and even older adults who have any type of underlying lung issues and all types of inflammatory. You can get there and you can start to really open things up. And we've all seen it. I mean, if you're a respiratory therapist, and Kristen's probably seen this, if you have somebody who comes in, they're in acute distress with asthma, sometimes before they give them the first neb, sometimes before they get the oxygen on, sometimes if you just have them take a few belly breaths, really use the diaphragm, really relax, really try to, and you can all of a sudden see like, oh, now their lungs don't sound so tight. Oh, now their SATs are starting to come up. You could actually make that change that fast. So I think the mind is really very, very powerful. Dr. Ambar up in Syracuse did a recent study where he actually just did imagery and sputum production. He actually just had this group of kids that were like 9 to 20 years of age actually just think of moving sputum out, and it worked. No pounds, no vests, no acapella, no huffing, nothing like that. Just thinking about moving this airways out. So again, I think it's very powerful. Also can reduce chronic symptoms such as cough. You have all seen people who get very anxious. They always want their albuterol. They always want their albuterol. They always want their albuterol because they think they're going to get tight. They can't have a hard time breathing. Well, if you can just teach them how to relax for that minute, then sometimes they don't need those medications. And we did a study in children with mild to moderate asthma where we got almost everybody off their inhaled corticosteroids just by doing relaxation. So breathing exercises can help with lung expansion, especially with yoga and martial arts. And this is just Dr. Ambar's poster that he presented last year at the American Thoracic Societies. Self-hypnosis as a complementary airway clearance technique in patients with CF. So he just had them just visualize the secretions down that lower airway, just kind of like marching up. And he actually did measured sputum, and it actually seemed like it made a difference as opposed to the kids and the young adults who didn't do that. Okay, my part that I don't like. It's not that I don't mind dietary supplements, it's just so hard because there's pills, there's freeze-dried capsules, there's powders, there's tinctures, there's syrups, there's teas, there's decoctions. I mean, which one do you use? Do you apply it? Do you eat it? Do you drink it? Do you smell it? Do you put it in a diffuser? I mean, they're hard to figure out, and every culture has a different way of doing it. You know, if you're from the Mexican culture, it's very different than if you're from Central America. It's very different if you're from South America. It's very different if you're from China. It's very different if you're from Western botanical, Eastern botanical. It's all different. And so what people do that drive me crazy is they take an herb from Chinese medicine, and they'll take an herb from European medicine, they'll take an herb from Mexican medicine, and they'll put it all in one capsule and think somehow that's going to work. How can that work? I mean, it'd be like I take a little bit of Toby, and I take a little bit of Cipro, and I take a little bit of Augmentin, and I mix it in, and I give it to you, and it's like, that probably is a good idea. I mean, we almost never do that. So, again, but they're the most common one that people use. In a study of CF patients, about 20% were reportedly using some type of supplement, and some people use a lot of supplements, and sometimes there's a lot of overlap. And when I was at the University of Arizona, we actually did a study seeing how much we could save people by decreasing how many supplements they took, because they were like, well, you don't need to take this antioxidant because you're already taking these 5. You don't need to take this immune enhancer because you're already taking these 4 over here. So we could actually try to figure out which ones seem to have the most evidence behind them, which ones have the least amount of side effects, which ones seem to have the most safety and efficacy. So you can actually look at that, and that's really up to you and your healthcare provider and anybody that you can help try to sort this out. And it's not easy, because what do you do when they're all mixed up together? And so there's some concern too, because even herbs may have interactions with conventional medicines. I mean, especially if you have allergies, a lot of these different type of dietary supplements came from plants. And sometimes I had this one patient that didn't have CF, but she had asthma, and she really wanted to change around, and she really wanted to get better, and she really wanted to try. All her big trigger was always viral-like illness. So I said, well, take some Echinacea. I had the right tincture because I studied at the University of Arizona, so I knew the right one to use. I said, and she told me, she came back to see me 2 months later, how'd it go? She said, oh, I ended up in the emergency room. And I said, well, how'd you do that? She said, I took the Echinacea, I had an allergic reaction. She got hives, she got striders, she couldn't breathe, because she had a plant allergy to the Echinacea because it's part of this one family that she was very allergic. And I didn't even think about that. She had all these airborne allergies to plants and weeds and grasses and mildew and stuff. And of course, that was just exactly the wrong thing to do. So you really have to think about this. The FDA doesn't really regulate this at all. I mean, they try to, but they really don't. And many times the plant itself is really hard to standardize. And that's one of the things that I like about plant medicine. I mean, one of the things that I think that's why Chinese medicine works so well, and it can, because they don't take just that little tiny part and make it like St. John's wort. They actually take the whole St. John's plant and give it to you. But it's very hard to study because there's hundreds, if not thousands, of different components to it. And they're all part of it. So how can you really standardize it to one substance or one chemical? And so people say, if you talk to your physician, they'll say, well, it's not standardized. Well, you can't standardize a plant because it's like thousands of things. That's why it's plant medicine. That's why people have used botanical and herbal remedies for thousands of years, because they know it all works in conjunction with the other. There may be something in the leaf that works with something in the flower, that works with something in the root. And so, again, it's just a whole different approach. So, again, I'm not saying that you can't use dietary supplements. I just say that it's hard to kind of sort them out. And if you're going to use them, it's best to do one approach and one kind of a tradition with them. This makes using them, understanding them hard. And there's also some that come from China and India and other places that have mercury in them, they have lead in them, they have antibiotics in them, they have steroids in them. So again, the quality is also an issue. And what's in those supplements anyway? Did you ever see this in the New York Times about a month ago? They looked at, New York Times looked at Walmart, Walgreens, Target, and GNC, and it showed that 4 out of 5 of the products contain none of the herbs. Well, that's a problem. I just spent, $35 on this bottle of echinacea, and there's no echinacea in it. So, so it's becoming more of a problem, and people are starting to really try to call this again, and so enough is enough. And this is another one of my slides that didn't come out. But what it says here is that this is another editorial that came out, was the bullet points. And they're saying there's over 65,000 separate dietary supplements that are now available in the United States. And so when people ask me, have you heard about this one? I always say, probably not, because there's like 65,000 of them, But I've heard of a lot of them. But again, they're hard to figure out. And some people are really trying to say, if we're going to have these, we really need to regulate them. We really need to get the politicians out of the herbal industry, because Orrin Hatch in Utah and Tom Harkin in Iowa, they were all very big into making the DSHEA Act, which made herbs and dietary supplements more like food, not like pharmaceuticals. In some way, that's good because they're not pharmaceuticals. In some way, that's bad because then people can sell you all this stuff that has nothing in it and not having regulation. So the herbal industry is actually trying to self-regulate themselves better, and so they're really working on this. They know that if they get press like this one in the New York Times, it's like killer. The GNC stores will be closing right and left. And also, the thing about those stores that drive you nuts too, me nuts. Like we go to the Staff of Life down in Santa Cruz. You walk in there, some 18-year-old telling you about how to treat your lung cancer, because, take this because it really helps lung cancer. It's like, I don't know if I should believe this person, but they seem like they're so confident. So I think enough is enough. I think if you're going to do dietary supplements, you need to have somebody on your team, whether it's conventional or non-conventionally trained, so some type of botanical person that has that expertise to help you with it. And I'd be happy to do that for a lot of my patients too, and I do that. And if I don't know, I reach out to people all over the country. I reach out to Ron Lodog down in Arizona, Francis Brinker in Phoenix, and these guys will write me back. And there's people like Christopher Hobbs, which is a internationally known botanical expert right here in the Santa Cruz Mountains. So the people are around that have this expertise. There are some studied supplements in CF, vitamin C, selenium, fish oil, omega-3s, all have been studied. They have variable results because, again, just like with diet, it's hard to study them because you really can't do it for like 6 months or 6 weeks. You need to probably do it for 6 years, right? So then just like nutrition, you need to have a long-term study. And by that time, everybody's changed, and you've been stressed out, you got a dog, you got a cat, you got allergies now, maybe you've gone off to school, you're not living with your parents anymore, so it's hard to do these long-term type of studies. Taurine was really popular back in the 80s because it's essential fatty acid that sometimes not absorbed, amino acid that's not absorbed very well. And it can help with fat absorption, so people actually showed that it helps with fat absorption. And taurine is in meats especially, so if you're a vegetarian, it could be a problem. And acetylcysteine, Dr. Conrad has been pushing this for now years, and I think it's showing very positive results, and it could be a standard treatment here pretty soon. That so-called mucomist that we hate to smell and hate to breathe in actually may be very good for your antioxidant components in your airways and your cells. Creatine has been studied. It shows increased muscle strength, at least short term, and you can get that at any health food store. And there's so many you might even think about. And here I just put a whole bunch of them down that there's just like, this is like, I could show you slide after slide after slide of people brought in to show me. And they're just some of the ones that I've seen. Grapefruit seed extract is one that's been very common. Probiotics, all your extra vitamin C, E's, and A's. Vitamin D, I think it's not even a vitamin. It's really a hormone that really improves lung health. And again, I'm not going to go into all these. That would be a whole talk just in itself. Just talking about some of the basic dietary supplements that actually may be very beneficial. Magnesium, I think garlic is one that people have really been interested in. We know that garlic has a direct effect on some Pseudomonas and makes them the quantum sorum talking that makes the Pseudomonas not speak to each other very well and not react as well. So, but how much garlic do you need to take? And if you did take that much, could you even be in the same room with anybody? I mean, those are all the things that people are trying to sort out. Essential oils for inhalation, some are taken by mouth. Again, some people have very good luck with this. They've eradicated MRSA and some Pseudomonas. But again, it's just things kind of come in waves as well. The one thing that I won't trash any of these too much because I think they all have their possibilities, and I think that they all in the right hands and the right way of taking them may be beneficial to some patients and families with CF. And so I think the side effects you have to be careful about. And this is just a quick example of one that I don't like, and that's colloidal silver. I know we have some patients who actually even do inhaled colloidal silver. All my botanical friends for the last 20 years all say, don't use colloidal silver. It's nature's antibiotic. It helps everything. And it's been used for a long, 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 long time, but it just has a lot of side effects. And if you take too much of it, it can actually turn your skin blue permanently. And so it's, again, there's other ones you can take that are better. And that's what they all say. It's like, well, it works and it's probably okay. And I have some friends that actually take it for their inflammatory bowel disease, their Crohn's and ulcerative colitis, and have had really good results with colloidal silver. So I'm not saying that it doesn't work. I'm just saying that I think there's other ones that are probably could be more beneficial without these significant side effects. Probiotics, I think, is almost not another one that I think that is almost one that we can't even talk about being a dietary supplement anymore. I think it's going to be really going to be one that almost everyone should take, and not just with antibiotics, but almost all the time, because we know that in the gut with the biome, which is all the organisms that are live in your gut, we know that if you have a lot of diversity and a lot of really healthy stuff, and maybe not the probiotics, maybe you should, the whole new craze, right, is fermented foods, right? So you should eat a lot of kimchi and a lot of sauerkraut and all those type of things too. It really improves your biome, and we know that you have a tendency to have less Pseudomonas and other type of pathogens in your lungs if you have a really healthy gut biome. So we know that if you're getting lots of antibiotics at a very early age, that can mess up your whole biome and really restrict it and make it much more narrower, and that could be a problem then with what you recruit into your airways. So we know that all is mixed in together. So your lung biome, your gut biome, they're not even talking about your microbiome in your heart now. Who knew that you have organisms that kind of hang out in your heart? I mean, how could that, doesn't things like flow fast through there, right? But they're there, and so people are really starting to study that. And Mike Tracy, one of our fellows, along with people at Stanford, are actually looking at the lung microbiome now, trying to show that maybe you can change that and you can actually affect illness and results that way. This is just a quick probiotics. I don't want to give too much time here. So a couple last words on manipulative therapies. Again, these are hard things to study as well. We did a study with osteopathic manipulation in children in Arizona, and we got like 4 osteopaths who were all willing to be part of the study. But we found out that all 4 osteopaths approached every person differently. So there's no standardized approach for an osteopath. They don't always say like, oh yeah, you need this particular type of craniosacral. Oh yeah, you need this type of strain counterstrain. Oh, you need this type of manipulation. They all do it differently. So it's very hard to study because just like with acupuncture and Chinese medicine, it's very individualistic. And so I think that's one of the nice things, and we've all heard about personalized medicine. That's the whole new catchword now. Everyone's going to look at your genotype. They're going to look at your microbiome. They're going to look at what type of CFTR you have. Then they're going to modify your treatments. Well, that's what we should be doing with all these things too. We modify what type of manipulation you have, what kind of mind body you have, what kind of nutrition you have, what kind of probiotic you take. I think it's all going to be part of that very personalized medicine. I talked about Chinese medicine again, about how it's moving this like vital energy through the body. It's this qi, it's the flows, it's intensity, it's acupuncture. Again, these are very hard things to study, you know, because you can't really you can try and do sham acupuncture, but if you're doing a study, what do? You put the needle in too far? You put the needle not in far enough? You twist it to the right instead of the left? I mean, you can see that trying to do a study with doing stuff like acupuncture doesn't work very well. And so I think that, again, I've had a lot of patients and families who tell me that they've gone to a Chinese medicine person and they've gotten great results with people using herbal remedies in Chinese medicine. And again, acupuncture, it's just one part of Chinese medicine. So to just take one part out and study it, I think it's very hard to do. So again, there was a study in Boston Children's that showed that acupuncture was effective in decreasing pain complaints. And we're actually doing a small study in adults with cystic fibrosis with chronic pain to see if acupuncture might help. I only mention homeopathic medicine because it's kind of popular, especially in California. And again, this has to do with, it's a different type of alternative medicine provider. We usually treat medicines like if you have a fever, we give you aspirin to counteract, or we give you Tylenol, acetaminophen to counteract the fever. In homeopathic medicine, we'd actually give you something that if you took large enough amounts, it would actually cause fever. So it's a law of similars. You treat something that actually causes the symptoms. You just give them really, really tiny amounts. And by tiny amounts, I mean the notation 6x means that they took 1 to 10, and then they did that again, 1 to 10, they did it again, 1 to 10, they did it again, 1 to 10. You get the idea, 6 times. So it'd be like 1 part in a million would be 6x. And and so when people say, yeah, take it, it's homeopathic, it means there's nothing in it anyway, right? There's not even a molecule in there. But for some people, it seems like it really works. And so I think that homeopathic medicine is something that people have used. It's been around since the 1800s. They've treated large animals with homeopathic medicine, so you can't just say it's placebo, right? Because the horse or the cow didn't know, like, oh, I think I'm getting a placebo here. They actually got homeopathic remedies that seem to improve. And so there's something about it. Maybe it's more energy medicine. Maybe there's something in the memory when you actually shook that molecule in there that whatever it caused, now it's trying to treat. And so this whole idea about this law of similars. And the thing that really drives conventionally trained physicians and practitioners nuts is the law of dilution. So the more diluted it is, the stronger it is. So 6x is not as strong as 30x. So 30x, that means there's not even one molecule, not Avogadro's number. Everybody remembers high school and chemistry. Not even one molecule in there at 30x. But that's the more stronger one. And so if you go to a really homeopathic practitioner, they'll try to find just the right remedy, and there's tens of thousands. There's snake venom, there's tuberculosis, there's flu. They use everything. They use every type of mineral, every plant, animal stuff you can. And they're not too worried about it because there's not even one molecule in there, right? So you can take a little bit of snake venom every so often, right, and not worry about it. But, I had somebody that asked me the other day from Oakland Children's that they wanted to inhale it. It's like, well, I don't know about inhaling snake venom. Even if there's not one molecule in there, it would still kind of bother me. So again, people kind of take these ideas and they kind of change them around and embellish them. And so I think it's something you always have to be on top of. And I just mentioned what these notations meant. And even homeopathic physicians agree that not one single molecule, the active substance, could remain in their remedies, but they still think that it works. And they've had a lot of success over the last 100 years to show that it does. My only point about homeopathy, if you run into a classically trained homeopathic physician, they may actually want you to stop all your conventional medicines because they believe that if you take things like steroids and antibiotics, it pushes disease inwards, and they want it to come out. And so they may try. So I don't mind working with conventionally trained, classically trained homeopathic, but they have to be somebody who can do it gradually. You can't just stop everything. You need to really do it very cautiously. So suppression of illness using such things as steroids or antibiotics could not cure the disease. In fact, it could drive it in. And in fact, if they give you a remedy and they see you have more symptoms, like all of a sudden your eczema gets a lot worse, they go, yay, that's good, because now it's coming out. Because they think like eczema gets driven in and it drives into asthma. So again, just a letter of caution. So my slides that didn't turn out on the bullets here. So integrated medical plan for CF. So this will be another audience participation, right? So of everything I said today, what do you think number one would be? What's the number one thing that you do if you're going to do cystic fibrosis care? Talk to your practitioner and discuss all your different thoughts and all your different things. Correct. What would be another one to do? Be adherent with your usual medications. So you really need to take your medications that we know help you. So I think that's very important. And then you develop a plan as to what you want to do and what you want to try, and you follow up on that plan. Then you try and do maybe things one at a time. So try lifestyle first. Try some exercise. Try some nutrition. Maybe you want to try some dietary supplement. That's okay. But if you do like everything all at once, sometimes it's very hard to sort out maybe what helped or maybe what didn't help. So I think try to have a plan that you can really change, you can really follow up on. If you're going to see outside practitioners, let the practitioners that you see in the clinic know who they are so we can communicate with them, so they can tell us what they're doing, we can tell them what we're doing, and we can kind of balance that off to make sure we're not doing things that are counterintuitive. And so I think that's really the integrative medical plan. You really want to have stuff that works together. You want to be able to be open and concise about it, and you want to have this open dialogue that could change very easily. And so conventional therapies, you want to put it all together. You want to talk about airway clearance, nutrition support, anti-inflammatories. There are some times that you can use some supplements in place of conventional medications, like some of the things like Singulair. Sometimes there's things like pine bark and grapefruit seed extract that actually can decrease inflammation. You consider yoga, martial arts, things like Tai Chi, meditation, exercise, I think is great. And if interested, you could talk about Chinese medicine, homeopathy, naturopathic medicine, all these other things, which I could talk about an hour on each one of them. So I think that this is kind of your kind of putting it all together. So with that, thanks. That's our beach that we go down to in Santa Cruz. That's where I headed back. And so this last part is just some wellness. There's Julie Desch here, and that's her new daywell.org. I think many of you guys know Tim, who has a site back in the East Coast, and he can actually he'll sponsor people to do things like join gyms and get treadmills and things like that. You can get scholarships. And my old patient down in Tucson, Ronnie Sharp, who has his blog Run Sick Boy Run, and also CFWW and CF Life. And again, these guys are very good people to run things through. They have very good chat rooms. They're important. I mean, they are open to everybody's talk. And so I think it's really nice, and it's really a communal event. And as far as some guides for using CAM, there's the National Center of Complementary Internal Medicine, although now it's called Integrative Medicine as well. The Office of Dietary Supplements, there's MedWatch, there's CAM on PubMed. There's Boston Longwood Herbal Task Force, which is out of Boston Children's, which has every herb that you almost ever think about. There's the Ohio State has a good one, Beth Israel has a good one, UC Berkeley has a nice wellness newsletter, and Sloan Kettering and others, most of your cancer centers now also have very good ones as well. For your practitioners, if they say, I just don't have time to do this, I'm sorry. You can say, you can go and get, I didn't put it on here, I'm sorry, but you can go and get Natural Medicine Comprehensive Database. It costs like $20 a month, or maybe it's $20 a year, almost nothing. And it's like every herb and every different remedy you can think of, you can go there and it tells you every study that's been done in people and humans, every side effect, every interaction. You can actually subscribe yourself. It's very easy to you can actually even put in different types of things like migraines, and it'll show you what people use traditionally for it. So it's Natural Comprehensive Medicine, Natural Medicine Comprehensive Database. I didn't put the website up. Or maybe I did. And there's also conferences you can go to. There's Consumer Lab. Oh, there it is. National Medicine Comprehensive Database. So it is on there too. So that's the one that I think that's very helpful. That's the one that I use almost exclusively now. And thanks. That's Rudy. So I'm sorry, I almost didn't give us much time for time, but okay. Thanks. I will say one last word. Sorry. I've been telling this to everybody, and you know, I think that every practitioner that comes in to see you as a family and as a child should have these three things in mind that's part of mindfulness. And I think that has to do with the right intention, the right attitude, and I think I think that's very important. And when people come to see you, and they really need to be focused, they really need to be in your space and really talking to you eye to eye and really listening to you. If you feel like they're not giving you that attention, and they're not coming in with that type of supportive treatment, then I think you should actually ask them to be. I even had one patient who said that she told her practitioner, I think maybe you should just leave for a while and come back when you're really ready to see me and pay attention to me. And that person's like, whoa, okay, you know, I got my attention. And then so you have to be attentive. You have to have intention too. I mean, you know me, if you come to see me, I'm going to be very up about getting you better. I'm not just going to go in there and just shake my head like, well, yeah, we'll see how things go. Hopefully, so you know, you really have to have the intention, because again, I think mind body is so important. I think having you have that enthusiasm makes a difference, and that's that same thing with the attitude. So it's that attention, and attitude really makes the difference. So I think you really should promote that. We're really trying to promote that in our clinic and everything that we do, and I think that you could also help that too. You really need to have that same type of energy too when you come in to see the practitioner. You need to have that attention, intention, and attitude as well. So thanks again.
One of the questions is regarding probiotics. There is some probiotics with there are antibiotic resistant, not made in this country, but made in Europe and South America. And I was giving that to my daughter when she is taking antibiotics. That's what the doctor back home recommended. But somebody told me here that it wasn't a good idea because the bacteria is very smart and may borrow the information of the antibodies, the antibiotic resistant from the probiotic. And
as far as I know, there's no evidence to show that probiotics at any time would interfere with antibiotic therapy. I think the only time you have to worry about probiotics is somebody maybe is really immune suppressed, you know, somebody with cancer or somebody that has, you know, has a difficulty fighting infection. So if you have really severe disease, maybe you're like, you know, really have almost no lung function, maybe you're on a transplant list, maybe you've been transplanted, then probiotics is a different story, because then you're taking billions of live organisms. But for the most part, they actually would enhance and help the antibodies by keeping your
correct, but I am talking about the probiotics that are antibiotic resistant while they are taking antibiotics, because if you give it to them, the regular ones, the antibiotics just kill them. So if you give them probiotics that have antibiotic resistant probiotics, that's what I am referring to. Is that a good idea? I was told yes, and then I was concerned about this.
I have to say I've not seen those probiotics, so I'll have to get back to you on that one.
Okay. So.
There's always something. Every time I talk to somebody, they always tell me something new. I didn't know that there was resistant probiotics that are available.
Yes, actually, back home, the doctor prescribed it together with antibiotics. Always.
Interesting. Well, it seems to me like it'd be a good idea, but.
And they are made in Germany.
Yeah, those Germans. Well, you know, that's what happened with homeopathy. It was very common in the United States, and then we got rid of it. I mean, Hahnemann University, people have heard of Hahnemann University in Philadelphia. That was, Hahnemann is the person who started homeopathy. And then we got rid of it in the 1800s, early 1900s. And so it went to Germany. And so, you know, it flourishes, you know, in Great Britain, you know, all the general practitioners actually practice homeopathy, almost 75% of them. So it's part of the culture in Europe, and here it's like, oh yeah, it's crazy, homeopathy doesn't make any sense. So again, it just depends on kind of what the tradition was.
Can I ask another question? Sure. Somebody else
Here,
wants to turn. I wanted to ask also about the grape seed extract. How much should you give a day for
Again,
person,
the
or
people that
do
I've
we
had-
know anything about
The
dosages?
person that I've known that's done the best is they don't use it every day. And what they do is they use it more prophylactically, or not prophylactically, but early onset of any type of viral-like illness. So they see a little congestion, they see a little increased cough, they see a little bit increased sputum production. Then they'll start it to see if they can help decrease the chances of having an exacerbation. And then they use it for usually anywhere from 5 to 10 to 15 days. And then they go back off of it. If they get better, fine. If they don't get better, then they go in to see their practitioner, and usually they have to go. It's not really, yeah. Right.
But I don't know if you use it in regular basics.
Right.
People online cannot hear you.
So she's just asking whether the grapeseed extract, if you use it ongoing, maybe it would help decrease your chances of having ongoing or colonization with Pseudomonas. And again, I think we would like that to happen, but I think if you take something all the time that doesn't work as well as you take it periodically. So I think if you take, what we worry about with Pseudomonas is that if you get your defenses down, if you start having more respiratory infections, you have more exacerbations, you have more lung issues, your lung function starts to drop, then your chances of getting more chronic Pseudomonas comes up. So if you use something like grapeseed extract, you use something like homeopathic, more the clinical type ones to try to decrease those exacerbations from going in down to your airways, that actually will help you not attain the Pseudomonas as much as anything.
We have a question from
Sure.
somebody online who wanted you to talk more about sleep hygiene and
So
the
sleep
role of health
hygiene
in
is
sleep.
actually straightforward. Go to bed. No. But it's amazing, about even young kids, especially if you cough. When I was a fellow a long time ago, I spent a weekend with another cystic fibrosis patient who was about my age at that time, in my mid-20s, and he coughed all night. We were going back to St. Louis. This is back before infection control. We were going back to St. Louis to run a 10K together because they wanted to show that CF patients can do anything. He was in his 20s. I was in my 20s. I said, I'll go back with you. I was a runner. And we spent the same, and he coughed all night. And I said the next morning, I said, how'd you do last night? How'd you sleep? He says, fine. I said, did you cough? He goes, no, I don't think so. And he coughed all night. And so what I'm trying to say is that, you get so used to some of these things sometimes you don't even realize that you're having this sleep disturbance. So, some places like Australia, New Zealand, other places are actually, and we've started to do it somewhat, we're actually starting to do sleep studies. Not so much to see if you have obstructive sleep apnea, not so much to see if you drop your oxygen, but just how restless are you and what can we do about that? So I think sleep hygiene depends on the severity of what you have. If you have quite a bit of lung involvement, then you're going to have more respiratory symptoms, and it's really important to try and improve those, especially at night. So maybe you do an extra treatment later on in the evening. Maybe you don't use your bronchodilator because it maybe keep you awake, but maybe you do more extra airway clearance trying to clear that out. Maybe you do a little relaxation, mind-body stuff to go to sleep before you do that. Anything you can to get your sleep. If you don't have much lung involvement, say you have pretty good lung function still, then you want to make sure you really maintain that, because we know if you don't do that, then you'll actually have more respiratory problems because you're more susceptible to viral-like illnesses and not good sleep hygiene and all the other issues. So again, most people don't realize how much sleep they need. Even at my age, you need at least 7 to 8 hours. Older kids and even adolescents need, maybe even a bit more. And so they're even some places are now starting to put schools back, not starting so early anymore, but start at 8 o'clock, 9 o'clock, even a little bit later, because they know they need to get that sleep if they're going to do well cognitively. So that's really what sleep hygiene is. Don't use all those things that bother you and keep you awake. So you should be looking at your screen on your iPad or your cell phone or your computer right before you go to bed, because that's light therapy. That messes up your whole circadian rhythm. That kind of puts you out of whack. So you really need to put that away for at least a couple hours before you go to bed. Again, you can do some other types of things for relaxation that can really make a difference. But if you're looking at those stimulations and you try to lay down, you don't get into your good sleep pattern. You don't get into your good dream relief sleeps. You don't get into your good stage 4 sleep. So that can make a big difference.
We have another online question. Dr. Mark, have you ever heard of Body Talk, a natural body energy therapy? It has worked wonders for me, non-CF, and my daughter with CF.
It's called Body Talk.
Body Talk.
How do you spell it?
He spells it B-O-D-Y, and it's one word actually, capital B and capital T.
T-O. Body Talk. No, I've not heard of it. Oh, Body Talk, like I'm talking, right? Body Talk. No, I've not heard of that, but I'd be fascinated. I would think I'll look that one up for sure. I haven't heard. There's so many things. There's the Buteyko breathing. Has everybody heard of Buteyko breathing, where you actually learn to breathe really, really, really shallowly? And there's a practitioner here in Palo Alto that's actually shot that. Because the whole thought is that if people tend to breathe too fast. When you breathe too fast, you kind of blow off your CO2, and you breathe off your CO2, it actually can cause a little bit of bronchoconstriction or makes your airways a little bit narrower. So this Russian guy back in the 60s started showing people if you started breathing really softly, for kids, he said you breathe like a mouse instead of like an elephant. Really shallow breathing. I think it may be more mind-body than anything, but it actually showed that you actually feel better. And I have some patients with really exercise limitations that when they started doing this really mindfulness breathing, it made a big difference. Just this really, really shallow breathing. So buteyko breathing is one. And they did, now there's been a couple of studies looking at not CF, but they've looked at COPD and also asthma with some of these breathing techniques like buteyko, and they actually show that they improve lung function. So again, I think it's one of these things that are starting to be out there that's very powerful.
We have another question. Is there any way to ask what probiotic you recommend for toddlers? We've been using Culturelle.
I think Culturelle is the one that is the one that's been used by most people. It's Lactobacillus GG. It's the one. It's from France. It's very well made. You don't have to worry about contamination. There's a lot of good brands out there. I mean, I think Jarrow, Jarrow, is another brand that people have used a lot. I think if you go to most of your health food stores, I mean, one of the things about probiotics, I think they're regulated a little bit differently. Actually, people actually look to see whether they have them in, but if you go with the major brands, they've been pretty good. Yeah. Right. Mercola, right? Yeah. So you're looking for billions, and people say, well, I don't need to take probiotics because I eat yogurt. Well, you're talking about, really much more, tens of thousands, millions more in these probiotic capsules and stuff than you are in like yogurt. Yogurt's fine, but if you really want to get the probiotic, it's probably better to take the probiotic. And again, you can do prebiotics. Don't forget about those. That's the whole food source, which may be even better than probiotics. And that's all these fermented foods now that people are eating. I'm not saying that you should go eat a little bit of rancid meat, but that's what some people are doing these days, because that's what our ancestors did, and it seemed like they were really healthy in some ways. But there's this whole funny area that people that are doing these things with it, because it has to do with those microorganisms that really kind of promotes this good gut biome that then maintains your health, because everything tends to enter through your GI tract, including different types of allergens and stress, and all those things can affect it. So I think that's the big push is this prebiotics, symbiotics, probiotics. Is that all? Well, thank you very much.
Very deep appreciation for you sharing your incredible insights with us. So thank you, everybody, for being here. Dr. Mark, thank you so much for sharing all your expertise and insights and incredible wealth of knowledge. And I want to again thank Genentech and Vertex for sponsoring tonight's series, and also a very special thanks to AbbVie and Gilead Sciences for being here and providing additional support. So from all of us at CFRI, we look forward to seeing you at our next Discovery Series, which will be back again on Tuesday, next month on Tuesday, April 14th. So thank you all, and good night.